my name's Michelle Gamba, and this is Group A06. We did our project on robotic-assisted surgeries. Starting off with the background of robotic-assisted surgery, robotic-assisted surgery is a type of machine created to assist surgeons for procedures to have better precision and control. The machine consists of a camera arm and another attachment with a mechanical arm holding the necessary surgical instruments attached. The machine is able to move and cut the operating area because the leading surgeon controls the mechanical arms via computer inside the operating room. This operating room also has assisting surgeons for help. The history of robotic-assisted surgery. There was a high demand for better precision and safer operations of surgery, and this is why they were first created. The Puma 560 was the first surgical robot to be used and was introduced in 1985. This surgical robot was used for selective brain biopsies. The Puma 560 was extremely successful, so much so that 2 years later, the Puma 560 went to do its first laparoscopic procedure, a cholecystectomy. Puma is also known as the Programmable Universal Machine for Assembly, or the Programmable Universal Manipulation Arm. This machine is composed of two main components that are connected by multi-conductor cables. The first component is the mechanical arm. There was no camera on the Puma 560's arm, and it was only able to hold surgical instruments. Similar to that of a human arm, it was able to rotate every individual part from the shoulder to its wrist. And finally, it was able to freely rotate for more than 180 degrees and reach up to 2 meters in order to efficiently reach the specific parts of the patient's body where they needed to make the incisions. The second main component was its control system. The first robotic-assisted surgery system that was approved by the FDA was invented by a company called Computer Motion, and it was called the AESOP machine. The AESOP system was initially used for endoscopic surgeries. The next important surgical robot came in 2000 when the FDA approved a new system called the Da Vinci Surgery System. This system has been considered to have been groundbreaking in surgery because it was able to perform general laparoscopic surgery. The difference between the Da Vinci system and the other older models was that this system had a 3D magnifying screen, which allowed the surgeon using the system to see where they are operating with a really high resolution. Because of this system, robotic-assisted surgery became well known worldwide.
The Da Vinci surgical system is the most advanced platform for minimally invasive surgery available in the world today. The integration of high-resolution 3D vision, wristed instruments, and intuitive motion control enable the Da Vinci surgeon to transcend the limitations of conventional surgical technologies. 3 network components comprise the Da Vinci surgical system: an ergonomic surgeon's console, a patient-side cart with 4 interactive robotic arms, and a high-definition 3D vision system. Seated at the console, the Da Vinci surgeon views a remarkably clear 3D image of the surgical field. The system scales, filters, and translates the movements of the surgeon's hands on the master controllers to 4 interactive robotic arms on the patient cart. The precisely controlled micro-movements of the Da Vinci instruments are enabled by the computer processors of the system. These dedicated processors perform millions of safety checks over the course of a procedure for enhanced surgical precision and control. Da Vinci EndoWrist instruments are designed with a unique wristed architecture that provides 7 degrees of freedom for a range of motion greater than even the human wrist. This proprietary design enables surgical maneuvers impossible with conventional laparoscopic tools. The system requires that every surgical maneuver is under the direct control of the surgeon. Redundant safety checks prevent autonomous movement of the instruments or the robotic arms. The Da Vinci S surgical system moves surgery forward with a new level of technical capability that enables minimally invasive surgery in complex procedures as never before. Da Vinci provides a streamlined surgical experience that benefits the hospital, the surgeon, the OR team, and, most importantly, the patient.
The Da Vinci surgical system is made up of 3 components. The first component is the surgeon console. Using the Da Vinci surgical system, the surgeon operates seated comfortably at a console while viewing a high-definition 3D image inside the patient's body. The surgeon's fingers grasp the master controls below the display with hands and wrists naturally positioned relative to his or her eyes. This system seamlessly translates the surgeon's hand, wrist, and finger movements into precise, real-time movements of the surgical instruments. The second component is the patient-side cart. The patient-side cart is where the patient is positioned during surgery. It includes either 3 or 4 robotic arms that carry out the surgeon's commands. The robotic arms move around fixed pivot points. The system requires that every surgical maneuver be under the direct control of the surgeon. Repeated safety checks prevent any independent movement of these instruments or robotic arms. The third and final component is the EndoWrist instruments. A full range of EndoWrist instruments is available to the surgeon while operating. These instruments are designed with 7 degrees of motion, a range of motion even greater than the human wrist. Each instrument has a specific surgical mission, such as clamping, suturing, and tissue manipulation. Moving on to robotic-assisted surgery in action. There are many procedures that use surgical robots, including coronary artery bypass, gallbladder removal, hip replacement, hysterectomy, total partial kidney removal, mitral valve repair, pyeloplasty, pyloroplasty, radical prostatectomy, radical cystectomy, tubal ligation, and many more. The success rate of robotic-assisted surgeries are about 95%. Upcoming surgeons are currently being trained for robotic surgery. Since the creation of robotic systems in surgery, it has become common for many med schools to teach new students on how to operate these machines. Not any average surgeon can use these machines. Robotic-assisted surgery for hospital use. Since the Da Vinci system had been approved by the FDA, more than 2,800 hospitals in the US had started to use these systems for surgery. The Da Vinci system wasn't just adopted within the US, but also around the world, such as South Korea, China, Europe, and others. A report back in 2016 had concluded that the robotic-assisted systems had been a great success, for it was used and performed in over 1.75 million procedures in the US.
At Cleveland Clinic Abu Dhabi, robotics is bringing the latest inventions in surgery to our patients. Robotics allows us to do things that was never before possible in surgery. It's an extension of our own eyes, allowing us to see in 3 dimensions. It's an extension of our own hands, allowing us to perform sophisticated surgeries through incisions the size of a finger.
Cleveland Clinic has a long history of advanced minimally invasive and robotic surgery, both in the United States and here in the Middle East. We've been doing these procedures for over 20 years. Complex, minimally invasive robotic surgeries in the field of urology are extremely common and allow us to treat patients with a broad spectrum of diseases, including prostate cancer, kidney cancer, adrenal cancer, and complex urologic reconstructive procedures such as pyeloplasties and ureteral reimplantation.
Robotic surgery benefits the surgeon in different aspects. First of them is avoiding surgical trauma. When we do some sort of operations, there is some trauma that disappears when you operate a patient under a robotic platform. Second advantage is the magnification of the operative field view. This is a 3D magnified image that we obtain through the robot console. Third important aspect that benefits the surgeon is the better ergonomic. The surgeon is sitting in the console and is doing his procedure comfortably.
We do the procedure that's best for the patient from a medical point of view, but the approach has to fit the body habitus of the patient. So not every patient is a candidate, but the candidates have to be chosen carefully through a multidisciplinary approach. The advantages of the robotic approach are decrease in the amount of blood loss, decreased time in wound healing because the incisions are very small, very little pain, and no restrictions after robotic surgery.
This technological leap has transformed the care of our patients. Safety is improved, the quality of the operations is better than ever before, and our patients benefit. They leave hospital and return to their lives with their families and in their communities much more rapidly than was ever possible before robotics came into being. At Cleveland Clinic Abu Dhabi, we will continue to push the boundaries of medicine. Robotics is a key cornerstone of that strategy, and we will continue to bring these types of advances to our patients at Cleveland Clinic Abu Dhabi.
The pros of robotic-assisted surgery, starting with a decrease in wound trauma, which means an unplanned injury during surgery. There are no hand tremors, which means better precision. For example, contusions where tissue is damaged because blood capillaries are ruptured. Another example is laceration when the surgeon's scalpel tears too much of the skin tissue. Another pro is faster operations and therefore a shorter hospital visit, and this also results in a quicker recovery time. More pros include decrease of complications after surgery, so little to no scarring and a lot less pain during the actual surgery, high dexterity for better precision, better visualization of where the surgeon needs to operate, and robotic-assisted surgery requires a supervised, certified surgeon to ensure that the process goes well. The cons of robotic-assisted surgery are there is a chance of mechanical error, which could harm the patient. These machines are very expensive to make, and they are also very expensive to upkeep. There's no human-to-human contact. Robotic-assisted surgery is still relatively new, so hospitals still are going to have to learn and adjust to the new technology. These machines are also very, very large, and they take up a lot of space. To conclude, there's not a lot of disadvantages to robotic-assisted surgery because these machines are fundamentally going to help with better surgery operations. Since this technology is going to continue to advance, robotic-assisted machines for surgery will continue to evolve and continue to get better. This also means that most likely having these machines will become more common to use and seen at hospitals a lot more often than we do now.